Okay, good morning, students. Now we will discuss about medication error. This is the first part from me, and I hope you have meet me in the other course, yeah. And for this course is basic clinical pharmacy, FK 4142, and with topic medication error, yeah. Okay, what is medication error? Anyone have any idea about this type of error? Okay, based on the National Coordinating Council for Medication Error Reporting and Prevention, the medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. So the highlight is event. So this is an event that cause or lead to inappropriate medication use to the patient while the medication is under control on professional, patient, or a consumer. Yeah. Okay. The other definition is from Aronson in 2009. This is the failure in the treatment process that leads to or has the potential to lead to harm to the patient. So the error can cause harm to the patient. Yeah. Indonesia also have any definition for medication error, and in this medication error can happen in every step of drug preparation, from the choice of drugs and then order through prescription, reading prescription, drug formulation, dispensing, and drug administration. Yeah, and we will see on the next slide about the definition and the type of medication error. Yeah. Okay, before that I will ask you, what is the difference between medication error and adverse drug reaction and adverse drug events? Okay, as I know, you have teach about adverse drug reaction and adverse drug events by Bu Irianti. And what is the difference between the medication error and the ADR or ADI? Yeah, please write your answers on your paper and give to me at the end of the meeting. Yeah. Okay. So this slide will describe and will explain to you about the importance of medication error detection and prevention. The first one is patient survival. So there are a lot of patient harm and death due to medication error, estimated about 44,000 until 98,000 patient death due to medication error, and more than 2,000 patient is dead due to medication errors. Yeah, and because of this medication error, patient trust will ruin in health service system, including medical staff, pharmacists also, and nurse. Yeah, and another important point is the cost. Yeah, medication error can increase the medication cost. Yeah, in USA, medication error affects 1.5 million individuals and adds hospital treatment costs as much as about 3.5 billion US dollar yearly. Yeah, so this make a high cost for the treatment, and it can be also harm to the patients. Yeah, and sometimes it can increase the patient length of stay. So in the long term, it can affect the productivity. Yeah, because of the medication error, especially if the patient got any harm or permanent harm, it can be decrease the quality of life also. Yeah. Okay. Anyone can give me the example of medication error regarding to the definition I have explained to you about the type of medication error, yeah, or the medication error can happen in every step of drug preparation, yeah, maybe in dispensing process or reading the prescription, yeah. So please also write what your opinion and what your insight about the example of medication error in your paper. This is the second question, yeah. After the first question, first question is the differences between medication error and ADR and ADI. And this is the second question. Please give me an example of medication error. Please write. I give you time about 2 minutes for the example, and please collect it in the end of the meeting, yeah. Okay, you have 10 seconds left for the questions, yeah. You have also more time if you have any other idea after you watch this video, yeah. Okay, I will continue to the next slide. This is an opportunity for error, yeah. There are several steps when you prepare the medication. If pharmacy apply the role in reducing risks, the potency of error will be decreased, and only one error that reach to the patient, yeah. For the example, first one is if you apply the administration medication history, or the pharmacist and the other healthcare professional admit and follow the formulary guideline. And then if the healthcare professional or pharmacist follow the prescribing protocols, and pharmacy have checked the allergy and also have a prospective review when they prepare the medication, and also follow the administration instruction and doing the clinical pharmacy services. And also if pharmacy have a good distribution system, the opportunity for error will reach the patient only one or less, yeah. There are less error to the patient if the pharmacy apply right role to the patient, so the risk will reduce. So what happen if pharmacy not apply this role, yeah? So it will be more error, yeah. So they will not apply whole of the process, or maybe only one or two or three, or a lot of procedure. We skip the procedure. Maybe there are more errors, yeah, reach to the patient. Okay, so it is important for the pharmacist and the other healthcare professional to prevent the medication error, yeah, and to have a good knowledge and have a good knowledge and prepare how to prevent the medication error. Okay, there are several types of medication error. The first one is contextual classification, and the second one is psychological classification, and the last is model classification. Actually, number 3 is general classification, and we usually use this classification when we assess the medication error, yeah. Okay, the contextual classification, this is the medication error that describe the moment, yeah, the moment. For example, only describe the place, time, or people involved. Yeah, people involved, yeah, and also the medicines that affect the medication errors, yeah. The second one is the classification that focus on the human resource, yeah, on or human error. Yeah, and the model classification is focused on the process. What the step? Yeah, what is the step that can affect patient got medication error? Yeah, so this is the differences between the three types of medication error, and usually we use model classification for assessing medication error. Okay, I will explain to you the second and the third one, yeah, in the next slide. Okay, this is physiological classification. Okay, error is defined when actions are intended but not performed. Yeah, so this potential error. Yeah, not performed. Okay, if performed, so you should classify it is in mistakes or skill-based error, slips and lapses. Yeah. In a mistakes, it is error in planning action, but for the skill-based error, error in executing correctly planned action. Yeah, so it can be start from the planning to the executing. Yeah, the first one that I will explain is mistakes or errors in planning action. The first one is knowledge-based error, and the second one is rule-based errors. Yeah. So for the knowledge-based error, for example, you forget. Yeah, a pharmacist forget about something. For example, about the adverse event from the drugs, or maybe the concentration of the drug, or you don't know how to prepare the new drug. Yeah, new coming drug, for example. The rule-based error, it can be divided into two type of error. So it can be good rules but not apply. Yeah, and then it can be bad rules. Yeah, so bad rules is related with SOP, yeah, or standard operating procedure. Yeah, and this mistakes is error in planning action. Yeah, so when the pharmacist plan to deliver and administer drug or prepare the medication, there are two potential error. Yeah, two potential error because of knowledge and because of the rule base. Yeah, for the rule base, it is related with the standard operating procedure. Okay, maybe for the good rules, there are standard operating procedure, but the pharmacist not apply or misapply. But for bad rules, the pharmacist not have a good standard operating procedure. And the next type is skill-based error. On skill-based error, there are action-based error and memory-based error. Memory-based error, actually, this is have similarity with knowledge-based error. Yeah. Okay. And for action-based error is technical error. Yeah. For example, in action-based error, pharmacist picking up a bottle containing diazepam from the pharmacy shelf when intending to take one containing diltiazem. Okay, so there are some problem with diltiazem and diazepam. Yeah. So it could be you take the diazepam. It should be you should take the diltiazem, but you forget. Yeah, you took the diazepam because a technical error. Yeah, for example, the shelf. Yeah, the shelf, because there are no self-organized. Yeah, organized. Okay, the memory-based error, or we call lapse. This is the knowledge error. For example, you forget about something or you don't know about something. It conclude to the memory-based error. Yeah. For example, when pharmacist giving penicillin, but you don't ask if patient have any allergies with the antibiotics, for example. Yeah. Okay. The third classification is model classification. This is based on drug delivery process. There are four type of model classification based on the drug delivery process. So the medication error can occur in every step of this process. It will be occur in prescribing step or transcribing step, dispensing, and also administering. Yeah. This is the prevalence for each process. The first one is prescribing, second one is administering. Okay, so the big error occurs in prescribing and administering. Yeah, so this is the important point for the pharmacist and healthcare professional to prevent the medication error and to help patient treat the problem, yeah, and reach the high quality of life. Okay, thank you. And this is several common cause in for medication error. The first one is strength on the label or packaging was confusing, yeah, because some of the packaging from one industry have a same pattern, yeah, of packaging. And the second one is look alike, sound alike drug, sound alike drug, and handwriting unreadable. So nowadays, we develop, and some hospital have developed the computerized prescriber to prevent the handwriting unreadable, especially in the etiquette or in the prescription by the physician. And the next common cause is incorrect rewriting of prescription or order, yeah. So the incorrect order, yeah, from the physician, or incorrect dose calculation by the pharmacist, or maybe physician, and the personnel is not have a sufficient skill, yeah. So lack of development schedule for the staff, yeah. And the other part is incorrect use of abbreviation in the order of label. Sometimes the physician or pharmacist have a usual abbreviation, yeah. The general is PCT. PCT is paracetamol, yeah. But if you want to make any abbreviation but not common in the hospital, maybe or in health terms, yeah, please do not use the abbreviation, yeah, that's not general to use, yeah. And the next is labeling error, and this is the important part, excessive personal workload, yeah. So the pharmacists usually have a lot of prescription to and lot of work to do the drug preparation process, but the personnel is we have a lack of personnel, yeah, or very tired and a high workload, so this also can cause medication error. Okay, this is the next is concentration, yeah, of the personnel, yeah, because this is related with the workload or maybe any interruption when the pharmacist prepare the medication. Okay, I think enough for the video for this segment, and please don't forget to collect your assignment on MS Teams, and I will continue on the next video with model classification explanation. Thank you.